Good afternoon, everyone, and welcome to the second broadcast of the 2015 Campbellsville University Senior Seminar Program. This is Sean Williams. I am the host or moderator for the discussion. Back with you again. If I'd like to introduce my two panelists real quick. First, we have Marco Aguazul. Hello, Marco.
How you doing?
And joining Marco again on our panel today is Ms. Caitlin Weeks. Caitlin, how are you doing?
Doing well, thank you.
So let's go ahead and get started. Today, the topic of our discussion is going to be healthcare policy, reforms to the healthcare industry. As we all know, healthcare has been one of the most hotly debated topics in political science and in politics over the last, I guess, probably 6 or 7 years. First coming up in the 2008 presidential election between Barack Obama and John McCain, and then ultimately culminating in Obamacare and the debate over reforms for Obamacare. And so today, once again, we are still considering whether or not we should reform Obamacare or how it should be implemented into American policy. So first of all, to get started for our viewers who may not be as aware of what the policy is all about, and whichever one of you wants to start off with this one, let's talk about some of the major concerns, the debate over healthcare policy in the United States. What is the debate all about?
I think before we can kind of talk about the debate, it's really important to kind of define a little bit more clearly what Obamacare actually is, because I think a lot of the debate can be about some of the gray area and confusion that's there. And so it's actually the official name for it is the Patient Protection and Affordable Care Act. And Obama signed this into law in 2010. And so under this, according to the Department of Health and Human Services, a couple of the, I guess, kind of the overarching umbrella would include such things as keeping young adults covered. So the 19 to 25 age population can be able to have continued health insurance coverage. And then there can also be kind of, I guess you could say, reviews for just increases in the premiums that you would pay for that insurance coverage, as well as having the right to choose what doctor that you would see. And those are just a couple of the services. I know Marco can touch on others. But I think it's just important to kind of solidify more of what that is before we talk about the sides, I guess.
Yeah, which I agree with what she's saying. And the big two differences is, the right side is more for free market capitalization, and then the left side, it's healthcare should be guaranteed, it's a right, it's ethical, and but then the right side sees there's what's it called? Oh man! But yeah, like I said, the left side is all about the right. It's not a privilege. It's a right. We want America to be healthy. We want America's people to be healthy, and that whole right is the right and left, or it's this constant argument back and forth with them two.
But what is the concern about? So is the problem that the American healthcare industry is really, really bad, and the quality of our healthcare is bad? Is the problem that Americans can't get healthcare coverage? Is the problem with insurance? What exactly is the big deal? Why are we all worried about this?
And with the insurance companies, I'm aware before, prior to Obamacare, this is an issue that came up. It's if you're currently sick and you're applying to get health care, the insurance company can reject you because you're sick, and you'll be a liability, and it'll just be more expenses on them. But then with Obamacare, they kind of eliminate that you, even if you are sick or you have history of being sick, you can still get health care, and just that. Obviously, that's not good for the insurance companies, because if they get on with an ill person, it will cost them more and more money. So it's not good for the insurance companies feel like it's not good for them and it's not fair to them.
When you say, so obviously there's the problem with the insurance companies. As an American citizen, is there anything that I should be worried about? Do I need to be concerned about the quality of my health care or the cost of my health care?
I think cost of healthcare is definitely something that I've learned more about in just looking into this, and how that prior to Obamacare, obviously the premium that you would pay for your insurance as is can still be on the rise and will continue to rise. But what I found to be kind of interesting is one of the problems that the right would definitely point out to Obamacare is that the premiums for Obamacare and what people could end up having to pay for a doctor that might not be covered by their particular coverage in that is that premium will also rise. And so I think to some extent the cost factor is definitely something that the American people are kind of on edge about, because no one wants to see that continuing to increase.
Yeah, cost is actually, I guess, a big problem. And yet one of the things that we also know is that per capita, the United States spends significantly more on healthcare really than any other country in the world, especially economically developed countries. Why do we spend so much money on healthcare, especially if we're not necessarily getting the benefits or the outcomes that other countries get?
Well, I found an article, and they I guess I didn't really say where they get the quote from, but it said that the best healthcare, that the U.S. has the best healthcare in the world, and whether I agree with that or not, it's, I guess, up to debate. But I do know that the United States they're leaders in the world of cancer research and cancer treatment, and yeah, so that's what
I think also, sorry, I didn't cut you off.
No, you're fine.
I think also we have a higher labor cost for doctors and nurses and other healthcare workers, as well as the cost of just like the paperwork alone that they fill out for one patient, and obviously they're seeing multiple different people. And so I think in just the day-to-day necessities of having a doctor's office or a hospital, those costs are higher, whereas in a different country, they may not even keep paperwork, or they may be paying their doctors or even specialists in a certain area a whole lot less.
Are you suggesting that maybe we pay our doctors too much, or are you suggesting that maybe we see too many of them? I mean, you mentioned the idea of the specialists. Is it that we have too highly specialized medicine? What do you think the problem is?
I don't necessarily think that we have too many specialists per se, because I do think that they serve a purpose. Like, they have specifically gone to school in order to know and be as prepared as they can for that specific area of medicine. So like an optometrist would be a specialist who would obviously deal with the eye, and I guess for me the difference between the United States and another nation would just be that either maybe it is that we do have more specialists because we have the ability for the schooling of that, whereas other countries might not. But I don't necessarily think that we have too many, that it's hurting anyone. I just think that that's kind of maybe why there's an imbalance between the money we're spending versus the money that's being spent in other countries.
Yeah, that may be it. Mark, I want to come back to something that you'd said, or you'd mentioned a second ago as we were introducing the topic of healthcare. You had briefly mentioned this debate or this argument about whether healthcare is a right or whether healthcare is a privilege. What exactly did you mean by that? Why is that debate relevant?
Well, like, obviously, America wants with the best for its people, wants to without like infringing on their, because a lot of people, Caitlin and I were talking about it earlier, that this whole law that went by, that the Obamacare, like it's, if you don't have insurance, you're going to get penalized for it, and Caitlin was brought it up that like that probably makes some people uneasy that they're being penalized for something that they feel it should be a right, but or like forcefully given that. But no, like obviously America wants what they think is best for their people, and obviously everybody wants to help out the little man, but that by helping them out, obviously we, like the big people, the people, the upper class people end up paying more to help out the little man, and some people don't agree with that.
How about you, Caitlin? What do you think? Do you think that healthcare is something we should think of as being more like a right, like having identification, or do you think it's something more like a privilege, like having a driver's license?
I do think that it should be seen as a right because, I mean, even going back to the Declaration of Independence, if we say that we really have the right to life, then I think that includes medical care, and in order to be able to have adequate medical care, I feel like you need to be able to have access to insurance, so you're not paying thousands upon thousands of dollars that you may or may not have depending on what your income level is and other things. And then I think it's interesting to look at, too, how the United Nations have, made a Declaration of Human Rights for various different countries who have all accepted the fact that right to medical care is, in fact, a right. And so I do think that that's true. However, when you look at the privilege, I think that there's kind of that argument of if you are, I guess, more wealthy and have the ability to, in a sense, kind of have the coverage you would like and maybe not be with Obamacare, there's kind of this idea that those that have more wealth or income kind of should have that privilege, but I really think that as Americans, both on the left and the right, that most people would see that any person residing in the U.S. should have that access. I think that's kind of the which I think we'll talk about in a minute, but the difference between, I guess, access and provision and kind of what that looks like, I think ties into it being a right or a privilege.
Yeah, and that is an interesting point. That is actually, I guess, probably a good segue as we start to think about what the government actually does. Because if we think about healthcare as being a privilege, it's something that you can only buy. But we could also talk about the idea of access to healthcare, that maybe everyone deserves access to healthcare, but quality of healthcare should be a function of how much money you can afford. Marco, what do you think? Do you think that when we talk about healthcare, it's really about everyone should get access, but the rich get better quality, or do you think that everyone should have to have reasonably the same quality?
Yeah, well, that sounds. When you say the quality of it, like the rich deserve the good, I mean, obviously they deserve the good and the poor deserve an alright service. But no, I think that we should all at least have some type of similarities. Yeah, there should be, like all groups in our nation, like I guess if we're divided by classes, I think all classes should have just a bit similar access to and provision to healthcare, but obviously those who are wealthier and better off will have a better access to it, I guess better healthcare without like offending anybody. But yeah, I think there should be at least some type of similarities there. That way, on the surface, people, I guess, don't get offended by it.
So maybe everyone who needs to go to the hospital gets to go to the hospital, but the rich, maybe they have private rooms with better accommodations and maybe more specialists, whereas somebody who is poor, maybe double occupancy rooms and not as many specialists. Is that kind of what you're talking about?
Yeah, I mean, I guess so. That's what it sounds like, without offending anybody.
Yeah, no, I understand completely. So so now we maybe have laid out sort of the groundworks of the problems with healthcare, the questions about healthcare in America. Let's focus in a little bit more and talk about healthcare policy in the United States and maybe what the role of government is in healthcare. So before we jump into, Ms. Weeks, you'd already talked a little bit about what Obamacare was. And before we jump into the specifics about what's wrong or what's right with Obamacare, there are three terms that come up a lot in the debate. One is Medicare, one is Medicaid, and the other are these ideas of the health exchanges or health marketplaces that are part of Obamacare. So let's take a second and talk about the difference between these three things. So, whichever one of you wants to jump in and whichever one you feel comfortable talking about, Medicare, Medicaid, and the insurance marketplaces or health exchanges. What are those all about?
Well, Medicare is primarily interested in individuals that are 65 years of age or older, or individuals who have disabilities, whether that's permanently or something such as kidney failure or just something of that sort. That's kind of mainly where it would focus in, and kind of the breakdown of that is that it's in four parts. Part A being hospital insurance, and so coverage for any patient that would need to be hospitalized during, for any reason, or receive hospice care, anything regarding specifically going to a hospital. And then Part B really focuses more on the medical insurance for doctor's visits or outpatient care, home health care, just a majority of things that aren't specifically being hospitalized. And then Part C kind of focuses on the ability for someone to choose in Part A and Part B about kind of how they will have those two things available to them, how they would like their hospital insurance to look and their medical insurance. And then Part D is kind of the more controversial part, focusing about prescription drugs and how they can now be accessed with Obamacare, whereas before you had to have your primary insurance in order to pay for any prescription drug that was prescribed to you.
And I know that Part D, I was started teaching, I guess, a couple of years before Part D was implemented into law during the Bush administration. And you're right, it was really controversial because it was sort of the first attempt by the government to provide or cover the cost of prescription drugs, which, as we think back to one of the questions we just mentioned, what's responsible for the rising cost of healthcare? I was actually just listening to NPR today, and they were saying that the cost of prescriptions, spending on prescription drugs increased by about 13% last year, largely because of the introduction of new medications which have yet to become generics, and that their argument was that the prescription drugs may be what's driving the increased cost of healthcare and maybe even the increased cost to the government. Marco, how about you? Do you want to take a shot at either Medicaid or the health exchanges?
Yeah, I guess with Medicaid, their more emphasis are on those who struggle financially, just helping them out, and obviously if they meet a certain standard, the government will help out. Depending on where they are, and I guess where they are, how much they make annually, and how many kids they have, all that playing to consideration. But yeah, Medicare is all about helping those who struggle financially, and but that meet certain standards.
And I think it's important too that each state has the ability to kind of dictate that, which I think is interesting because Medicare is more federally focused. It's kind of a blanket. This is you fit into our parameters in this way, whereas Medicaid can kind of fluctuate depending, Kentucky versus Tennessee or however else.
And it's actually, I think, I'm glad that you mentioned the state component of Medicaid, because you're actually right, because as we think about your original discussion on what Obamacare is or the Affordable Health Care Act is, it's actually the Affordable Care Act's movement into what has traditionally been considered to be a state-level responsibility. Both of the introduction of these healthcare exchanges, where as a private citizen can go and purchase insurance on a private exchange that's been pooled somehow in the same way that I might get it through my employer, but also through the federal government's involvement in Medicaid. Why is this controversial? Why is the idea of the federal government getting involved in either Medicaid at the state level or these health exchanges at the state level? Why is this a problem? What questions have come up? Marco, why don't you take a shot at it?
All right. I guess with this whole thing, like separation of the federal and then state, when the federal government wants to get into the state government, people get kind of, I guess, uneased about the situation. But I like with the whole online healthcare exchange, I like they're giving states I guess the responsibility to run the website, make it easier for people to access healthcare. Government, I didn't really. That's one of the things that I kind of struggle with one of your questions. Is I couldn't really find anywhere that came up with this whole federal government stepping into the state government, rather how they manage their Medicaid and whatnot.
In addition to the state question, there's also the question of religious freedoms and religious rights. We've been talking the last couple of weeks about what's happened in Indiana with Indiana's attempt to pass its own version of the Religious Protection Act the United States government passed several years ago, and also the influence that Obamacare may have had in the need to pass that act. Ms. Weeks, talk a little bit about the religious questions that have come up with Obamacare, if you can, and why some people are really concerned that maybe religious freedoms are being infringed upon.
I guess kind of two of the main questions or thoughts that come to my mind, especially looking from the religious side of things. Obviously, those that are practicing in some sort of faith are going to kind of look at this issue and see that if there's someone in need, and especially in need of some sort of medical service, that like we kind of talked about before, that they should have that access. But then at the same side of that coin, I think that they could also see it as maybe more of an infringement upon their religious freedom to kind of be able to, especially with, as we were talking about Medicaid, with an elderly population, kind of if they're being forced to have an insurance provider that they may or may not want, then does it kind of maybe influence the choice or the question of like right to life, and I guess kind of what they would see as right in their own eyes of that, and being kind of infringed upon in that way.
Marco, do you have any insight or any questions about that?
Yeah, it's just kind of to echo what Caitlin said. Yeah, like obviously there's some religions that, I mean, religious people that get sick and they feel like their faith will heal them. Their faith will their faith in whatever they believe in will heal them. And then with this now Obamacare saying that if you don't have health care, you will get penalized. And then obviously that makes people, like Caitlin said, they feel like they're being infringed on their I guess freedom of religion, because in their faith they feel more secure that though whatever sickness comes, it will be healed with their I guess the deity they believe in, or the God they believe in.
As we think about the constitutional questions that have emerged beyond the question of states' rights, I think so far we have had two major Supreme Court cases that have dealt with Obamacare. The first one was in 2012, which was a question about states' rights and whether or not the states had to adopt the healthcare exchanges and the Medicaid portion. And then most recently, it was the Hobby Lobby decision. The Hobby Lobby decision, for those viewers who may not remember, the Hobby Lobby case was the one where the Supreme Court determined that closely held private corporations didn't necessarily have to follow all of the Affordable Health Care Act's provisions if it infringed on their religious beliefs. An example being providing birth control to female employees whenever providing such birth control was against the religious belief. The current question that's coming up, I guess, takes that one step further and is now asking whether or not, because of how these healthcare exchanges have been set up, whether or not states that participate or do not participate should get the same discounts for their citizens. What do you guys think? How do you think that question is going to be resolved?
I think that states that are currently opposed to Obamacare and not maybe enforcing a different idea for Medicaid and that sort of thing, I kind of think that kind of with the access versus with kind of the access question of just that they still should have the access to those discounts, but I kind of feel that as though the federal government probably wouldn't want to allow that, being that their state isn't kind of working with the federal government. It would kind of be like, well, why are we going to give you this if you're not really kind of giving us anything in return?
Okay, we only have a couple of minutes left. For those viewers who maybe are sort of on the fence, maybe you're not really quite sure which political party you're thinking about voting for as we look towards the 2016 presidential election, kind of give us a quick rundown. If you're listening to the Republican candidates, what do we expect them to say about the Affordable Care Act? What do we expect their positions to be? As you're looking towards the Democratic presidential candidates who may be running, what should we expect them to say? What does the future of the Affordable Care Act look like it's going to be, depending on which political party controls Congress and the White House in the next 2 or 3 years? Marco, why don't you start us off with that?
Yeah, I guess with the Democrats, they're more, I guess they'll stay with what's in place. Obviously, they'll make some alterations, but majority, obviously, they want to make sure that those who need healthcare get healthcare, and so that will remain in act with the whole Obamacare. Yeah, but on the Republican side, obviously, a lot disagree with what's going on. So I guess a new revision of the Affordable Healthcare Act will come. To what it is, I'm not really aware, but again, with back to the Democratic side, they will definitely try to make some alterations. The stuff that make people uneasy, they'll try to, I guess, make it acceptable. But yeah, with Democrats, they want to make sure that everybody gets health care. Like those who need it have it, and those who are sick also, like, they also acquire it.
So, Caitlin, what about the Republicans? What would I expect to hear from Republican candidates like Jeb Bush or Rand Paul or Mark Rubio while they're talking about the Affordable Care Act and health care provision?
Well, I think that the Republican Party, there's always going to be, the far right that will say that this act and Obamacare as a whole really just isn't effective. It's terrible for the economy, for Americans. It's just really awful, and that it should just be taken away with and done away with. But I think in order to gain favor in the American public's eyes, they will probably try to take a stance a little bit lighter than that, in the sense of some big reforms, maybe changing, just, I guess, starting with clarifying what exactly it is, because like I said before, I think that there's just a lot of confusion and people are really frustrated with it because they don't quite understand how it fully will impact them as an individual. And then I think the Republicans will try and just kind of make changes, amendments per se, to a couple of the specific kind of controversial issues of even looking at like the younger population that they talked about at first, how that if you're 19 to 25, are you really reliable for having coverage in this way, and just making changes so that they can kind of find a middle ground, because I don't think anyone would elect a Republican that just completely wanted the whole thing gone away with. And then I think as far as the future goes, I think, as Marco said so well, that everyone on both sides, I think for the most part, would say that access should be granted. So I think in the next 5 to 10 years, it'll just be defining what provision exactly means and what the government sees fit for the states as a whole to kind of implement.
Yeah, well, I think you're right. It is going to be interesting to see. We certainly know that many of the parts of the Obamacare are popular with the people, and so far all of the Republican Party's attempts to repeal it outright haven't necessarily gone very well. Well, I'm afraid that's all the time we have, so we're going to have to leave it there. For those of you who may be watching, either live streaming or later on YouTube, we definitely appreciate your participation. I also want to say a thank you to my guests, Marco Aguazil, and thank you very much, and Caitlin Weeks. I appreciate your time. Please join us again next time whenever Senior Seminar Panel has another discussion on current events and public policy. Thank you very much.